The number of patients keeps growing, and so do hospital bed shortages. The rapid spread of a new variant of coronavirus has put unprecedented strain on British medical facilities. At St George's Hospital in London, wards had to be rearranged to accommodate more COVID patients.
This used to be our cardiothoracic intensive care unit. It's 21 beds, and for probably since the beginning of December, this has been a COVID intensive care unit.
The hospital has doubled the number of beds, but there are still not enough, and patients with other diseases are having to suffer the consequences of the emergency measures.
We have people in their 40s, their 30s, their 20s on our intensive care unit dying of COVID. We are having to think about whether we do cancer surgery. We're having to postpone cancer surgery because of the number of COVID patients we have in.
England, as well as Scotland, finally entered a fresh lockdown on Tuesday, by which time the nation's hospitals had already been overwhelmed. The new mutant coronavirus is 50 to 70% more contagious. In the past month, the number of new COVID cases has almost quadrupled.
It's the first Monday after Christmas and New Year's, and it's been one of the worst shifts of my entire life. Intense. I'm looking after many more sick patients than I normally look after. It's just overwhelming, the whole situation.
To ease the pressure on British hospitals, the government is speeding up its vaccination campaign. With a second Oxford AstraZeneca vaccine now being rolled out, it aims to inoculate all medical workers as well as people over 70. That's about 14 million people in total by mid-February.